Thank you very much for inviting me to be part of this important chance to reflect. I don't think we're out of the woods yet, but we're certainly in a different position than we were almost 2 years ago. So, as Raj said, my job is to talk about mental health. I am unashamedly going to focus mostly on children and young people because that's where we have the least data and I think sadly the most impact, but I will talk about working age adults as well. The first thing to say is we came into this pandemic with a gap in data for children, and there is a huge amount of information out there. I'll show you just how much work has been published on children in a minute. And there is an issue of time versus quality. So there have been a plethora of social media questionnaires using all different kinds of outcomes. And at the beginning, they were very useful. Some of them have been fantastic, like the UCL social study during COVID, which has been as high quality as that kind of study without a sample frame can be. However, if you don't know your sample frame and you don't know your response rate, you have what's called a non-probability sample, and all our statistical assumptions are based on probability samples. So in other words, you don't have a very sound theoretical basis for statistical inference. And just because the samples are often very big does not mean that they're just for bias. So there was a study of over 52,000 that came out of China, but it had 65% women in a society where actually the gender balance is very much skewed the other way. So whilst that would have probably given you fairly sound information on women, it's not going to tell you a lot about the men, because there will inevitably be differences between those who respond and don't respond. And weighting can only partially address this. And in fact, it can make it worse because you're privileging those who have responded in the underrepresented groups. There is a heroic systematic review run by colleagues in McGill University. And as of last week, when I prepared the slides for this talk, they had screened approaching 80,000 abstracts and titles for 3 linked systematic reviews on mental health. The first was about changes in mental health, either pre to during the pandemic or during the pandemic, as long as there was some kind of a baseline, some kind of defined population, and an appropriate measure. Review 2 had looser criteria and was about factors associated with change, but they were so swamped by materials that they stopped this review in the September of 2020 because they felt it wasn't really going to show anything useful. The quality of papers was just too low and there were just too many of them. And then one about interventions related to mental health during COVID. So nearly 80,000 abstracts. They found 170 of those studies, so a tiny proportion were good enough to be included in the first review about changes in mental health, and only 11 of those relate to children and young people. So we are, starving in the midst of plenty. There is a lot of work out there. Sadly, not much of it is of useful quality. So my job is to pick out some of the salient findings from those studies that are better quality. And just to pick up on Raj's point that we may have all been in this together, and I think that sense of a shared experience is almost certainly protective. We haven't been impacted the same way, and looking at a whole population and how that changes can mask important differences. So there's some very interesting work that's come out of the School for Public Health on the Bristol site, where somebody had gone into 17 schools in the southwest of England, in and around Bristol, And they'd got data from 1,000 youngsters who were aged between 13 and 14 at the time. They went in October. When COVID hit, they had the prescience to go in again in April, and they also are going in repeatedly. Now, overall, they found no difference on a standardized questionnaire of depressive symptoms. Likewise, I could show you the same for anxiety, and I could show you the same thing for well-being. But what this graph I've flashed up has shown is that comparing pre-pandemic, October 2019, to early in the first lockdown, those who were at risk of depression actually were doing much better, significantly better when they went back. And those without depression, there wasn't a significant change. And if anything, there's a hint that they're doing slightly worse, which is very interesting and something that various other studies have found as well. For example, the national survey data, which I'll show you later, Oxwell as well, which is a bigger study of schools across 6 counties, 8 to 18-year-olds, and about 19,000 of them. And whilst probably, depending on age group, round about a third to almost a half said that lockdown had made their life worse, there was a significant proportion, often a fifth or more, who said that actually lockdown had made life better. And I think we need to understand what that's about, because it's a rather sad indictment of the lives these children were living. So I can show you the same thing for anxiety and also for well-being. The graph I've just put up now relates to working age adults. So starting age 16, going on. This is from Understanding Society's own data. The lead author is Matthias Pearce from Manchester. And what he examined was the pre-pandemic to post-pandemic change, and then later trajectories for different groups. Now, in the first study, where it was only the first COVID sweep, what we showed were some worrying new vulnerability groups. So parents with young children were doing significantly worse. Also, the expected groups, people with existing mental health conditions, and also those living in more deprived circumstances. And then this translates into, you have 5 groups here. So the mental health outcome measure is the general health questionnaire, and a high score indicates more psychological distress. And what you can see from this is that there are, hopefully you can see my mouse, there are 2 groups with good, consistently good or very good mental health. Then there are 2 groups where there is a deterioration, one of which is essentially sustained, the other one which gradually makes it back to, by September 2020, to almost where they'd been, and another group where their mental health just deteriorated. Now, if you were older, bearing in mind this is working age adults, so we're talking up to middle age, you were white ethnicity, you were affluent, you could work from home, you had financial, job and food security, you were much more likely to be in the good and consistently good. Whereas if you had a pre-existing mental health condition, you lived in socioeconomic deprivation, or indeed your financial and housing situation had become less stable, you were much more likely to be among those who struggled. Some of you may have heard of the Cospace Study. This was run from Oxford. Kathy Cresswell was the lead. She managed to get it into the field very, very quickly. It is a social media collected panel, so therefore, despite their very best efforts, it's predominantly white people with a real struggle to get ethnic minority families to respond, and it's predominantly the most affluent. And I think the first thing that came out won't be of any surprise to anyone who's been in this situation, that parents were finding it a real struggle to balance work and parenting. They were very worried about their child's well-being, and they were worried about the amount of time their children were spending on screens. And they found some interesting things following up, that parents reported children had worse mental health, particularly behaviour. And by children, I mean at the under 11. Whereas young people, again, in this survey, reported that emotional problems were reduced, but they felt more restless. And particularly if you had a pre-existing mental health condition or special educational needs, again, decreased emotional difficulties initially. Interestingly, the young people themselves reported no change. So some of this may have been parents worrying. Tracking this Cospace sample over time, so you can see that on the graph you have fluctuations in the major problems assessed by the Strengths and Difficulties questionnaire, which was used in this and many other studies. So you have sort of attention, concentration, emotional symptoms, so anxiety, sadness, and behavioral problems. The highest scores were for not being able to attend and being fidgety and restless, and the lowest for behaviour over the whole population. So behaviour was more of a problem amongst 4 to 10-year-olds, and actually this pattern of fluctuation with increasing symptoms during lockdown, decreasing as things open up, and then increasing again was seen, which is really interesting. It's again one of the studies pointing to the fact that for children being shut away from peers, and particularly for young children for whom social media and remote teaching, I imagine, is much, much harder to do, is really not desirable. And in fact, prior to COVID, there were data from previous epidemics which weren't as severe, which did suggest that actually not being able to go to school, being in quarantine, did impact mental health with increased anxiety, depression, and sometimes post-traumatic stress disorder, depending on what the people had experienced, and that went across age groups. But I do wonder, part of the mediation of that association was stigma. So the fact that this affected all of us at the same time may actually be protective. So now I'm going to talk about the national surveys, which I have been involved with for over 20 years. So we had a big gap in the survey programme for children and young people in relation to mental health between 2004 and 2017. But obviously, when the pandemic hit, it made absolute sense to go back to this carefully constructed probability sample of 9,500 children and young people who were aged 2 to 19 in 2017 to see how they were getting on. So we have done 2 follow-ups to date, one in the summer of 2020 and one approximately a year ago, and there is about another wave about to go into the field. It was an online survey where the parents of those under 16 were contacted with permission sought from the parents for young people aged 10 to 16 to complete a questionnaire, and young people aged 17 up were also invited to complete. The response rate was disappointing, partly because there hadn't been any keeping in touch. This wasn't a longitudinal study, although there had been plans to do a 3-year follow-up. In fact, in the end, it wasn't commissioned. And the idea was to compare mental health across the time points, to describe life during the pandemic. And for 2021, there was a focus on ethnic group variations and a great deal of attention targeting both those from economic deprived areas and those from ethnic minority backgrounds, to try and get as high a proportion of them as possible. Now, in 2017, there was a very detailed assessment that involved interviews with parents and young children and a questionnaire to teachers if the family agreed. We obviously couldn't do that repeatedly. So we use the Strengths and Difficulties questionnaire, and there is a diagnostic algorithm that allows you to combine the information from informants when you have more than one, and will run on one person if that's all you have. And that divides young people into those unlikely to have a mental health condition, those who possibly have one, and those who probably have one. So we've taken the probable as an index of caseness and combined the other two groups. So running that algorithm in 2017, 1 in 9 young people of age 6 to 16, what in old money would have been compulsory school age, had a probable mental health condition. That deteriorated in July 2020 to 1 in 6, and that deterioration has been maintained. We had to use a slightly odd age range because by 2021, 6 was the youngest age group, and because the youngsters are getting older, we're 16 seemed a logical point to stop. So here are the rates of probable mental disorder in 2021. You can see amongst the primary school kids on the left that boys predominate. It's more even, but girls are edging ahead at secondary school age, and girls have over double the prevalence of probable mental health conditions by late teenage, early adulthood, what the WHO would call emerging adults. Now, none of that is a surprise. That is a pattern we'd expect to see, except the prevalence is very, very high. What we can see here is eating problems. And again, we would expect this difference with more in teenagers, more in girls at both ages. But the jump up in eating problems, and I'm using the term problems deliberately because we couldn't do the whole diagnostic manual. So we used the screening questions that weed out who needs to go through the whole diagnostic interview, and we are now completing those this time round to give a proper prevalence, but it is worrying and it fits the referral figures. So whilst the presentation of eating disorders, urgent and emergency presentations have doubled at the end of last year, during the first lockdown, we saw a massive decrease in people seeking help. And that was repeated in our survey with lots of people, almost half, saying that they thought they had a problem, but they wouldn't go and seek help. And we are following that group up with qualitative interviews to find out more about why. So the other thing to say, as well as the increase in probable mental health conditions, there's also increase in risk factors, including sleep, but also loneliness, and in other surveys, gambling, drinking, exposure to things that you wouldn't want young people to be exposed to. And as you can see, there's quite an association between being in poor mental health, having a probable mental health condition, and finding that the first lockdown made your life worse, but actually about a fifth in this sample said it made their life better or much better. And then finally, to pick up the experience of families, a lot of the risk factors that cross-sectionally, we haven't had the data in order to be able to do any longitudinal analysis yet, but cross-sectionally are strongly associated with being more likely to have a probable mental health condition, are the ones that you'd expect. So parental poor mental health, socioeconomic deprivation, poorer family function. Now, all of those, there could be a two-way relationship. The increase in prevalence is seen across age groups, although more marked in the older teenagers, across gender, but I've talked about the gender pattern, and across ethnicities. But actually, the impact is differential by ethnic group. So as you'll see, those who are white British are much more likely to be working from home, whereas those from Black African or Black British backgrounds are much more likely to be the group most likely to have fallen behind with bills, rent or mortgage, and other ethnic minorities are just behind them. So just to wind up, why should we be worried about the economic side of this? Well, for mental health at any age, these factors really count. So what you're seeing here is from early in this century, children who were looked after, any different diagnosis and all the different diagnostic groups against the most deprived in the private household surveys. So these are children living in families where nobody has ever worked. And you'll see that there is a step change, and then the rest of the 1999 survey. So there is a very, very strong association with socioeconomic deprivation and poor mental health. The other reason we should worry is that these are not transient problems. So this is putting together the 2004 and the 99 survey, both of which had 3-year follow-up. And you'll see of those that met diagnostic criteria at the baseline, 3 years later, half of them also met diagnostic criteria. So we should be worried about the mental health of our children. We found that this clinical population has got significantly bigger, that there's also a bigger vulnerable group, but 5 out of 6 of our population of children and young people are still doing okay. So we need to act to try and reduce the number of people who are vulnerable and the impact of those vulnerabilities on their mental health, and those who have clinical needs need prompt help. But the news isn't all bad, and I will stop there. Thank you very much.